Okay, Mr. V, identify that fungus.
Septated, septated.
Are you going over them or are you giving me slides?
Hmm?
Are you going
Penicillin?
over them or are you giving me slides?
No.
I know I gave it last week, so identify
No,
it.
I asked you a question. You can't ask me a question with another question.
You asked me if I'm going over them.
I asked you, were you going to give me slides or are you going, or you're going over them? That's it.
I'm just going over them. So you should know.
No new slides? Okay.
No, so you should know the answer to that.
No.
So what's the organism?
I have no idea.
Jesus.
Penicillin? No.
Yeah, penicillin. You have it in your book. It's right in your book on the fungi.
Wait,
You know that's fungi,
That's
right?
penicillin?
Yeah, penicillin, yeah.
You know that's fungi, right?
Yeah, it's like penicillin. I
Okay. Good.
found myself.
Yeah, okay.
Is it, how do you tell the septation, not septated or septated?
You can basically, the non-septated fungi.
Mm-hmm.
If you look at it under the microscope, as opposed to a septated fungi, if you get a closer look at it, you see that like individual cell, the mycelium individual cell.
Okay.
Here it just flows. You
Yeah.
have no septate. This would be a mucor.
Uh-huh.
Like this would be maybe aspergillus, a penicillin, Histoplasma capsulatum, and so.
That is septated then.
Yeah, that's
Okay.
septate.
All right.
I always believe that taking pictures is one thing, drawing it also another thing. Because when you make your own drawing, you know, sometimes you look at your drawing, you go back, you can really, know what you're looking at. So, name that fungi there.
Where's the septation though?
No, just
Hmm?
a penicillin.
The
Septation,
septation is just the one that.
it's like inside of them, if you
Now,
look at them.
if
they're
somebody asked you to
segmented
identify this,
in the hyphae.
what would you identify it as?
Physically, it's segments in the hyphae,
Okay.
like that.
A mold. No, what kind of worm? What kind of worm would look like that?
That's an aspergillus, right?
That's an aspergillus.
Aspergillus.
Ms. Ventura? Ms. Perez?
That's yeast.
I know that. Which one is it?
But Candida albicans? Candida albicans?
No.
No?
Size?
Forgot.
Go ahead.
You want to know the name of the hospital?
No, I want you to name, identify the organism. Anybody can identify that organism? Go ahead.
Cryptococcus uniform.
Cryptococcus neoformans.
Cryptococcus
Now just draw one
neoformans.
on the board. In other words, you have the big capsule. The big capsule surrounding the organism. Cryptococcus neoformans.
Cryptococcus neoformans. Okay. Meningitis.
That's just basically a budding
It's the
yeast.
body.
This is a sort of hyphae. Then you'll find like with Candida albicans can form this type of hyphae. You have some budding yeast. But that's not a good slide. Mold. So you find that in the bathroom, you know that it is black. So therefore you would identify it as Aspergillus niger. Aspergillus niger.
Aspergillus niger.
R. G-E-R. Aspergillus niger.
Niger.
Mold, but it's identified as Aspergillus niger.
Niger's black.
So, Si, you want to identify this?
Cryptococcus neoformans.
Cryptococcus neoformans. See, the one I drew on the board was exactly like that.
That's
You
right.
have the big capsule, you have the body yeast inside of it. In other words, where could you find this? What?
Spinal
This
fluid.
A
is
spinal fluid. In other words, if you were asked to make a diagnosis, you could do an Indian ink preparation. That's where you take the spinal fluid, mix it with some Indian ink. If you notice, the background is kind of dark and the capsule is short. This represents like a negative staining. So you have the capsule showing up the capsule and then showing the organism, the negative stain.
pretty much the same thing.
Some is Martinez. And you identify that organism.
No, I don't know.
So if you have it there, why don't you know what it is?
Because I recorded you and I took a picture at the same time, but I haven't had time to listen to the recording and write down the name of the organism.
That's the reason I say you draw it and you put a name next to it. And it simply means you just look in your textbook, look in your book, and says, that's a cryptococcus neoformans because it's right there.
Exactly.
Instead of-
I haven't had the time to do it.
No, right now you draw it and you name it.
Oh,
You draw it
so that's the same.
and you name it.
That's the same as the other one?
Cryptococcus neoformans, spinal fluid, got the black background. You see, taking a picture of it and then recording it. How quick is it if you draw it and name it and then look at it? Which one is faster? Stop wasting yourself.
Do both.
Indian ink. Now you take the spinal, you take the spinal fluid, you mix it with some Indian ink on the slide, put a cover slip on it, and that's what you see. Now these are just larger magnifications of it.
Oh shit.
Now this is just a budding yeast that's this is in the serum where the organism begin to grow. In other words, form a germ tube. You can use that to identify the organisms as Candida albicans. In other words, here you have a fungi, and I think this organism is Sportrichum shankia. And the disease is caused is,
Rose thorn disease.
what?
Rose thorn
So-
disease.
Your rose thorn disease, subcutaneous mycosis. Is this a dimorphic fungi?
Yeah.
Yes.
Sportrix shankia.
Mr. Samuel, identify that organism. Did anybody draw this organism last week? Anybody draw
I
it?
remember this is
I remember this one. But
Huh?
this
Now,
is-
the thing about it is, you took the picture of this organism last week, you're taking it again
Chikuri.
this week. Now, if you had drawn it last week, Miss Perez, all you'd have to do is flip the page and tell me what the organism is, wouldn't it? Didn't I tell you last week? Draw this stuff.
What happens if you don't know how to draw?
What? So what's the name of the organism?
When you said you
Did you draw it last week? You drew it, but you didn't put the name next. That is the macrocanidia of Microsporum canis that causes dermatomycosis. The macrocanidia, not micro, macrocanidia of Microsporum canis. Macro, M-A-C-R-O.
Microsporum canis.
what is it called again? That one?
Ringworm. Entamoeba histolytica. That is the cis form of entamoeba histolytica. So, Ms. Perez, can you identify that organism for me? Giardia lamblia. How do I make the diagnosis? It causes malabsorption. I didn't answer that. That's how do I make the diagnosis? Ms. Ventura, help her out.
Isn't it, acid fast? Acid fast? The acid fast thing?
Think again.
Huh?
Think again.
That's red and blue.
You see any red there?
There's not a stain, that's,
That's just schmutz in the stool. Ms. Birthright, how do I make a diagnosis of this organism?
Depends on the morphology, the way that it looks. You see the little flagella and also the way the body is, that you just growing.
Yeah. Is there any alternate way I could identify this organism?
You see the little eyeballs looking back at you, right?
Yeah, but a patient comes into the institution. The patient has malabsorption. The patient is losing weight. I look in the stool and I find nothing. Which other method could I use to find if the patient has Giardia? Go ahead. The entero test. In other words, where I give the patient the gelatin to swallow. And then I scrape this stuff off and put it on the slide and look at it. And I'll find this organism with the two big eyes looking back at me. The entero test. Giardia lamblia. Yeah, right there on the board too.
the one without the, is right here. So there's the new ones like, yeah, he's
It's in the lab book also. We just went over.